Thank you, Devine. Good morning. I'm Rob White. I'm the Director of External Affairs at the Department of Psychiatry at the University of Maryland in downtown Baltimore. And on behalf of myself and Dr. Chris Welsh, our Medical Director, I want to welcome you to the 9th Annual Maryland Conference on Problem Gambling. I'd like to thank our Director, Mary Drexler, and her wonderful team of counselors, peers, and administrative staff. They've done a great job in presenting another high-quality educational event for the Maryland treatment community. I would also like to thank and acknowledge our partners at the Department of Health and the Behavioral Health Administration, especially Laura Burns Hefner, Mary Vigiani, and Kathy Riebert Franklin. Their support and guidance has been essential for the success of the program. Keith White, the director of the National Council on Problem Gambling, says our center in Maryland has become one of the leading programs in the country in a very short time. If you want to know more about the center, I would suggest you check out our website. It will describe all of the great work and programs that Mary and her team offer. Just Google the phrase Maryland Problem Gambling, and it will pop right up. Some of the key initiatives include providing a free and confidential 24-hour helpline, 1-800-GAMBLER, educating the citizens of Maryland about the risks of gambling and gambling addiction through public awareness, training counselors, educators, prevention specialists, and others, creating a network of problem gambling capable treatment providers, maintaining a problem gambler counselor referral list, assisting individuals through peer recovery support, developing and implementing prevention and community outreach, providing public policy information on strategies to address problem gambling, engaging in evaluation and research. So without further ado, I'll turn it over to our director, Mary Drexler.
Hello, everyone. Apparently, for some reason, it will not allow me to share my video, but we will work on that.
Mary, go ahead and try now.
Okay. It is still not allowing me to share my video. Sorry about that.
Nope, you were just up, Mary. There you are. We
Here I
see you.
am. I am here. I want to thank Rob for that introduction. And also I want to thank all of you for joining us today at the Center of Excellence on Problem Gambling's 9th annual conference. We're so excited to see such an interest once again on the topic of problem gambling. We have close to 800 registrants today. So again, I am so pleased to see that kind of registration. Today's lineup of speakers are not going to disappoint you. But before we move on and my introductions of those presentations, I just want to be sure to thank all of the center staff for their hard work and dedication, not only in helping to prepare for today's conference, but their ongoing dedication to providing quality services for those individuals struggling with problem gambling and to their families who struggle and get impacted by the gambling behavior. I would also like to thank Rob White and Chris Welsh from the University of Maryland, Baltimore, who provide ongoing support to all the staff here at the center. So to begin, it is my pleasure to introduce Ms. Kathleen Rebert Franklin, who serves as the Director of Service Access and Practice Innovation Division within the Behavioral Health Administration of the Maryland Department of Health. In this role, she is responsible for increasing access to behavioral health care through points of intervention inside and outside of the treatment and recovery system. We are pleased to have her join us today. Please welcome Ms. Kathleen Rebert Franklin.
Thank you very much, Mary. That was a generous introduction. I'm really pleased to be here. It's great that this activity is taking place. I appreciate the center and all that you do. Your leadership in this space is well recognized and well known now throughout the country and throughout the world. And we have you to thank for that. So our partnership has really reaped positive rewards. So if you can start the slide deck, please. Gambling is an important issue. It's recognized by the Behavioral Health Administration as one of our priorities. And we are grateful to be able to speak with you about some of the activities happening within BHA in response to gambling disorders. Next slide. So as we all know, untreated gambling disorders can create multiple problems. It causes financial, emotional, family problems. There are research studies that show its co-occurrence with substance use and mental disorders. And so it really can ravage a person and their family and their community. And so we want to make sure that our services are directed as best as possible to mitigate these problems. We know that language matters. Language can lead to stigma, or language can respond to stigma in a positive way. So there are words that we don't use. These words evolve over time. We know that they're not static. And so some of us may have been using words that are no longer acknowledged as appropriate, and we want to respect those changes. Stigma prevents individuals from getting into treatment. It prevents families from reaching out for support. It prevents communities from acknowledging the consequences of a gambling disorder. And so words do matter, and we need to use the proper words so that the professionals around us, especially those in the healthcare profession, treat those with a gambling disorder as they need to be treated with screening and then referral to services. Next slide. We have some data sets that we want to draw from today to show you some data on individuals around the state. These are the 3 data sets we'll be drawing on in the next several slides. Next slide. So this shows the gambling by gender and race. As you can see, males identified themselves in this YRBS survey, the Youth Risk Behavior Survey. 31% identified as gambling in the last year, versus females, who identified themselves as 13% who gambled in this past year, with a total of 22% on average. And then when we look at it broken down by race, although Hispanic has the highest percentage, we can see that all races are fairly close in proximity to each other. So what this tells us, what this slide tells us, is that gambling is happening in our high schools. They have access to gambling activities, and they're engaging in gambling activities, and this is the start of potentially gambling disorders. Next slide. So this shows the breakdown of the previous slide information. It shows the breakdown by jurisdiction in the state. And as you can see, Baltimore City has the highest rate of students reporting gambling. However, the distinction between the highest and the lowest is not that great. And so this tells us that across the state, students are engaging in this. This is not a problem that's restricted to one area of the state. It is throughout the state. Next slide. Voluntary exclusion program is a prevention program that is hosted by the Maryland Lottery and Gaming Control Agency, an agency in the state of Maryland. And this is a prevention program that makes it so that individuals who self-acknowledge as having a problem with gambling can sign up to exclude themselves from casinos, from venues that provide gambling. And they do this through an application to the Lottery and Gaming Control Agency, wherein they voluntarily say that they do not want to go into a casino. This means that if they were to go into a casino, they couldn't use a credit card or other ways of getting cash to play. It means that if they are in a casino, that is not allowed. It is actually illegal. And there could be law enforcement consequences if caught. It means that if they play and they win, they cannot collect those earnings. They can't collect they can't collect anything from, for instance, if they play the lottery and they try to cash in their lottery ticket. So there are consequences to this. And what this does is it really gives someone a chance at saying to themselves and committing to not going into a venue where they are unable to control their play. So next slide. What the previous slide showed is that there's an increase in voluntary exclusion programs, voluntary exclusions over the past years, especially the past year. And unfortunately, simultaneously, we're having an equal increase in violations. You know, the casinos were shut down for a while in 2020. And so this number may have been artificially deflated. But in 2021, we believe it reflects the fact that casinos are now back open for business. The more people that apply for the voluntary exclusion program, the more violations there will be. So that is not an unexpected increase. Next slide. So this moves on to the next data set where the National Council on Problem Gambling conducted a survey, including in Maryland. And this identifies that, could you raise this slide just a bit? Is that possible? I'm sorry, it's hidden. The information is hidden from me, so I'm unable to interpret the slide. So 57, thank you. 57% of Marylanders disagreed that they gamble only for entertainment, not for money. So that's the question. Do you gamble only for entertainment, not to win money? 57% disagree with that. So they're actually going into the casinos to win, And if they don't win, what happens? Those with the gambling disorder stay and they continue to gamble. There were 24% that were neutral, and then, I'm so sorry, I misread the slide. And then 57% actually agree with the statement, I gamble only for entertainment, not to win money. 19% disagree. So that is a good sign that only 19% disagree with the statement that they gamble for money, gamble for entertainment, not for money. Next slide. So this, no, go back one. There you go. This question is about linking gambling to alcohol and drugs, saying that it is a problem that is similar to those, and 79% of Marylanders agree that it is similar, that it is an addiction, and that is a significant acknowledgement of the fact that this is an addiction and that we do need to be screening for this problem. Next slide. So this slide is really important because it shows whether people know what to do, even if they know a loved one is having problems with gambling. And unfortunately, only 44% of Marylanders know where to get help. And so that's on us. We need to do a better job of getting information out about where to get help for gambling disorders. Next slide. So I'm going to speak a little bit about legislation and funding. Next slide. Maryland did expand betting in the state through new legislation. So in November, legalized sports betting was approved. This bill allows for sports betting to happen in specific venues. There are licenses that have to be applied for and given out. These licenses are available to casinos, to places such as the fairgrounds, the racetracks, and then some regular retail outlets, as well as mobile gambling venues. So there's going to be a number of opportunities for people to gamble. As opportunities increase, so must our prevention and treatment efforts. Next slide. The fund that helps support the Center of Excellence and other services it draws on a fund that is available through funds that casinos have to give to the state every year. It's based on the number of number of tables and the number of video lottery terminals. So it is a number that is not static, because the number of these two ways of playing, of gambling, do change over time. In addition, when casinos were shut down for a period in 2020 due to COVID, there was a significant drop, obviously, in the fees that would be paid to the state. So the fund that allows us to provide the services that I'm going to be talking about has decreased. We are not sure that it will ever get back to our FY19 high of 5.4 million because of now all the ways that people can gamble without having to go into a casino. Next slide. The funds pay for a variety of services, including free gambling treatment. Regardless of insurance, individuals are able to get this service for free. No copay, no deductible, no insurance is involved. We have the funds set aside for that. There's free family peer support available through a partner Maryland Coalition of Families. We provide public awareness messaging, and then the Center of Excellence for clinical and research. Next slide. For the no-cost treatment initiative, as I mentioned, regardless of insurance, individuals are able to get free services. And this applies to different types of providers, private practitioners, as well as community-based treatment programs. And we pay for these services at specific kind of levels of care. So for in SUD programs, it's level 1 and 2.1, which is outpatient and intensive outpatient. And then there are some residential services where gambling is reimbursed. And then of course, outpatient mental health programs are eligible. If there's a provider in the community that is interested, if you're listening right now and you're interested in becoming a provider for gambling services, please let us know. We would be happy to walk you through the application process. It is a separate application process, and it is paid through Optum, but it's separate because of this, exception that we have that no one has to pay for any of the treatment services. Next slide. So the Center of Excellence, which is the recipient of funding, has two components, clinical and research. For the clinical component, they maintain a hotline, which is critical for individuals to be able to reach help, the initial access point of help. They maintain web services because, as we know, people are using more than a hotline, especially if they're trying to just initially look at information to determine whether they might need additional help or whether someone in their family might have a problem and they're not ready to talk to anyone yet. They manage the treatment provider continuum so that we make sure that our providers are trained and competent to provide services. They provide peer support. This is really critical for individuals who might be seeking assistance. To speak to someone who has been there, done that, can be a tremendous motivator and incentive for individuals to then take the next step that they need to take. Education to providers is free. So if a provider is interested in signing up, there is no cost for training for your staff. And there's public awareness messaging that goes out from the Center of Excellence, and they keep an eye on legislation and provide support for the positions that we think we should be taking on legislative action. Next slide. So the research component of the COE conducts prevalence studies and community impact studies. And this gives us current information on what's happening in our community. COVID-19 affected services greatly. It affected the casinos, it affected treatment providers. And so we really wanted to understand how COVID affected us as a whole in this past year. And so studies were done to find some information out about that. Next slide. We hosted National Problem Gambling Screening Day. This is where we encourage providers to screen everyone for a gambling disorder. That does not happen in the regular course of business. Some are doing it, but we really want to engage everyone in doing it, as well as individuals who are not in the treatment sector, but are in our healthcare system. We want healthcare providers to be screening because individuals with gambling disorders, as I've said, show a co-occurring problem, including with health disorders. And so there's an opportunity to screen and refer individuals who present to a provider's office. Next slide. The Center of Excellence had a campaign theme that they put out. Hopefully you've seen some of this information around. We believe in diversifying the venues in which information is put out. So gas pump toppers is something that is newer to us. And I don't know about you, but I listen because I'm standing there pumping my gas. So it's an effective way of getting information to individuals, in addition to our radio, billboard, and internet digital ads. Next slide. So Behavioral Health Administration, where I work, has also put out an ad, and it focused on sports betting. And we're going to be showing this at the end within a minute or so. And it really focused on the sports betting because that's newer to our state now. And we wanted to make sure people had information about this. Again, it shows on a variety of venues so that we can make sure we get people in no matter where they are. Next slide. And some information about Problem Gambling Awareness Month and the success of it. You can see that although our hotline calls increased, what really is of note is the website. So we believe that people are getting into the website because of, we know it's because of the additional information that's been put out during this month. There's a direct connection there. We know that to be true. But the percent of increase over year after year is just incredible. Over a 2,000% increase in website visits. That means we're reaching more people. More people are interested. More people are searching for information. And that is the first step towards doing something, taking either calling or seeking assistance in a different way. Next slide. So these are resources that are available. If there's a provider that's interested in signing up to be a provider for gambling treatment services, please contact the Maryland Center of Excellence, and they will walk you through the process. Maryland Coalition of Families, I mentioned them. They are a significant partner with providing family peer support. So those families who are wanting to talk about a loved one that they are concerned about, they can contact Maryland Coalition of Families. And a family peer would be available to speak with them. And now we're going to show the PSA that I mentioned earlier that's focused on sports betting. So if you can pull that up, I'd appreciate it.
Gambling can be a fun and entertaining experience, but there are risks involved. If you're planning on betting on the game at the casino or on your phone or computer, know your limit, stay within it. Set a budget and a time to stop. Remember, gambling isn't a financial solution and it doesn't mix well with alcohol or drugs. Know the risks and have a plan before you begin gambling. For free and confidential services, call 1-800-GAMBLER 24/7 or go to helpmygamblingproblem.org.
Thank you.
Welcome again. Thank you. I want to thank Kathleen, number one, for joining us this morning and sharing this information on gambling and problem gambling. But now I am really pleased to introduce our keynote speaker for this morning. We have known each other for several years. Mr. Victor Ortiz is a social worker with over 25 years of experience in the development of programs and services in the area of addiction, youth development, child welfare, and behavioral health. He has worked extensively with a wide range of populations, especially in addressing health disparities and promoting equity and social justice. Victor has served in various positions that are aimed at improving access and advocacy of care for not just individuals, but for their families as well. His presentation today is entitled Problem Gambling and Public Health, Expanding the Lens to Mitigate Harm. Please welcome Mr. Victor Ortiz.
Thank you so much, Mary, for that wonderful introduction. Good morning, Maryland. How are we doing this morning? As a lifelong suffering Orioles fan, it is phenomenal to be back in the state of Maryland. I am grateful for the invitation and this opportunity to both share and learn at this conference. So I'm going to pull up my slide here so we can get going. Just a thumbs up if everyone can see that. It'll be fantastic. So before I begin, thank you so much. Before I begin, I just want to the honor and the pleasure to be here this morning. I want to first thank once again Mary Drexler for the warm, not only introduction, but the invitation. Thank you, Mary, for the invitation to be part of this conference. I also want to extend a thanks to Robert White and thank him for the continuous support on this work. And also the folks behind the scenes, to Devine and Janelle and a bunch of folks who make this process so easy for people like myself just to be present today and put all this work together. So just special thanks to them. So thank you so much. You know, the title of this conference is Navigating the Road to Recovery and the changing landscape of problem gambling. And as I was preparing this particular presentation, I thought about this title quite a bit and thought about, you know, when we think about this road to recovery, the question that we have to ask, well, there are many questions, but one in particular is, what afflictions did we experience to put us or to potentially be able to be on a road to recovery? And the fact of the matter that not everyone's road is equal or the same. So I hope that today I can shed some light on some of these areas that I think are critical in this day and time as it relates to problem gambling. But before I do that, I want to first start by facilitating my my ethical responsibility to state that this presentation and my presence here today is not affiliated with my full-time capacity as the director of the Office of Problem Gambling Services at the Department of Public Health in Massachusetts. I am here of my own, and there is nothing that I am saying here that presents any conflict of interest. In addition, I just want to state that I am home and my grandmother's home here in Puerto Rico, and so you won't hear my dog Chewy barking in the background because he didn't make the trip, but you might hear some other animals in the back, so just be aware of that. But it's I send you greetings from this wonderful, beautiful island that is about 100 degrees out here today. So just wanted to share that with you as well. When we talk about problem gambling or any issue, one of the key questions that we have to ask ourselves to do some level setting or just to be centered is that any social phenomenon must be understood within a historical context. I think this is extremely critical for us to take a really close look at this phenomenon of problem gambling within that historical framework. Second is that the ever evolving growth of gambling exposure that is so different today than it was yesterday, and its impacts are more understood today than ever before, must be understood and grounded in evidence. in order for us to continue to work towards the mitigation of harm, we must continue to utilize data and evidence as a compass to guide us to strategies to mitigate harm. And the third piece that I want to share in regards to this work is that public policy related to gambling must be aimed to protect the most vulnerable and at risk in our society. Look, we are at the crossroads of this field, and there are many conversations that we need to continue to have in order for us to continue to travel this journey of not only raising awareness of problem gambling, but strategies to mitigate harm. You know, Dr. King says that our lives begin to end the day we become silent about the things that matter. And so for us to be on this road to recovery means that we may speak of things and say things that are critical and important that might make some of us uncomfortable. As I was taught as a student many years ago, that comfort is not the goal. And that, you know, in order for us to do this hard work, there are conversations that need to be had. And I hope that we continue to have those conversations in order to be on this journey of recovery. So when we think about this historical context, let me just start there. There is a whole host of information that's out there that really captures the history of gambling in this country. And in particular, one that is really acknowledged by many and cited by many is one that is illustrated by gambling law expert I. Nelson Rose. And he captured what is called the 3 waves of gambling. And I think that these 3 waves of gambling really captures this framing of this evolution of gambling in our country. Now, I believe that in this day and time, that we are currently in the 4th wave. Hence, why I think that we are probably at the most critical juncture of our field and really at the crossroads of our field as the gambling landscape continues to evolve. So it gives us pause to think about this 4th wave. And what is this 4th wave? Well, one is, as I mentioned, the gambling environment is evolving. The experience of gambling as we know it today is not the same of yesterday. And at the center of that evolution is the advancements of technology. And this, even with technology, specifically as it relates to COVID-19, which is the greatest public health challenge of our lifetime, has really illuminated technology advancements that are incredible. The mere fact that I can sit here as an example in my grandmother's home here in Puerto Rico and conduct this via Zoom to over 500 or 600 or 700 individuals in the state of Maryland is an example of that technological advancement, right? We understand that there's this debate and argument between gaming and gambling. The intersection between video gaming and also gambling is quite interesting conversation. In addition, we know that gambling is perceived as an even more important source of public revenue. But the last 2 are my focus areas: marginalized communities and health disparities. Let me state that the field of problem gambling has historically been disconnected from the community experience in gambling and people of color. And we must not only acknowledge that, we must work to change that disconnect. We also know today the complexity and the association of problem gambling to other related issues. The days of developing strategies of problem gambling that are isolated, disconnected, or segregated from other health issues, those days are over. We must move to an integrated public health model in order to mitigate harms associated with gambling. But let me make my last point on this. Our work collectively is to mitigate harm. But I'm here to tell you that we will not accomplish our goal of mitigating harms associated with gambling if we do not center our work on equity. I want you to hold on to that statement for a second, because I'm going to prove my point today. It'll be impossible for us to mitigate harm if we not only center equity, but continue with our disconnection of the community experience of gambling and people of color. Let me move on. Now, centered to a lot of the work that we see in our field is the term often noted as responsible gambling. When we think about responsible gambling, there are some elements that are beneficial. One, at the center, at the core of responsible gambling is consumer protection. At the same time, the center of, the central points of responsible gambling that was introduced first by the Reno model calls for the need for evidence in order to establish strategies. And that is also a positive element. And as part of that framework also states the need for the engagement of stakeholders. And let me say that these elements are really positive. But at the same time, I am pushing us to think beyond what I believe is a narrow element here to a much broader thinking of problem gambling, and that is a public health model. But let me share what the downsides are, or the sides of concerns, or sides opportunities. One is that one size does not fit all. Oftentimes when I'm speaking or engaging with many people all over the country in regards to responsible gambling, we have a tendency to replicate things that are staples within responsible gambling. Things like voluntary self-exclusion, or illustrating the odds of a slot machine, and believing that we can just replicate that and that those elements could be effective. We know that there's a question that is being raised and an argument that's being had about who is really responsible here. Whether it was I don't believe it was intentional here, but we must acknowledge the notion that the whole aspect of responsible gambling is putting the burden of responsibility and even the projections on the individual. And that in itself is problematic. And that we must think about this critically to not stigmatize individuals or unintentionally stigmatize people who are experiencing significant distress related to their gambling experience. And as I mentioned, as it is the case with the field of problem gambling, so is the case with the responsible gambling efforts, is that communities of color are often not engaged and overlooked in these efforts. Now, to give you a concrete example, oftentimes what I see is that there will be some kind of strategies around RG that's developed, And at the last moment, I might get a call from somebody who says, hey, can you help us identify, translating our materials, or may put a person of color on a brochure. That is not representative of true engagement of people of color, of just simply translation or illustration on some brochure. So to that extent, I had the honor of a lifetime to participate in a book that was first of its kind, that captures primary stakeholders' perspectives. And I got a chance with my wonderful brother and colleague, Dr. Haned Hernandez, to publish a chapter that illustrates these perspectives on RG that was titled Public Health and Social Justice, Considerations to Inform Research, Policy, and Practice. It's the first chapter to my knowledge and what has been shared with me. It's the first chapter or any publication that was written in regards to RG that takes on this perspective. And again, it was an honor of a lifetime to share that, because we have a responsibility not only to call these things out, but to bring this to the table in our collective effort to mitigate harms associated with gambling. So let's take a look at some of the gambling research. There are things today that we understand that we didn't know yesterday. For example, it was noted in the presentation earlier that the intersectionality of problem gambling with both mental health disorders and mental health disorders. We understand today that over 90% of problem gamblers have a pre-existing mental health or other substance abuse related disorder prior to the onset of a gambling disorder. Hence the point that I made earlier. Our days of working in isolation, segregated, independent only on problem gambling, those days are over. I can't echo that enough. We must move rapidly into a integrated model that really looks at the broad construct of public health. Now, another point that I think is critical here is that in Massachusetts, based on a prevalence study that was conducted, identified the rate of the prevalence of recreational gambling in Massachusetts. And let me just pause here for a second, because when we think about recreational gambling, this is the group of individuals that we say these individuals are safe from developing a problem related to gambling, or this is the group of people that are less likely to develop a gambling disorder. And some of that element is true. And so we feel like this is our get out of jail free card. These are recreational gamblers. It's safe. We check it off the box and we move on. But when we put a public health lens on recreational gamblers, we see that they're more likely to be obese, smoke heavily, use alcohol, and use prescription drugs. Hence the value of public health, because we're seeing other health issues that recreational gamblers are experiencing. They might not lead to problems related to gambling or experience of gambling disorders, but they are currently have other health related issues. And so that does not promote the health and wellness of people nor communities. Again, the value of public health. So now, we also know by research is that research shows that the prevalence rate of disorder gambling among Blacks, Native and Asian Americans are higher than whites. So the question becomes is, what is the cause of this health disparity? Again, when we state that we are navigating the road to recovery. Not everyone's afflictions are the same. Not everyone's experience are the same. And so we must do the hard work and have the hard conversation to say, what is the cause of this health disparity? Now, I believe that when we think about this, as a way to think about this, we must start at what we know in social work practice at the macro. And in the macro, there are policies that we must look at from other areas to begin to think critically about what are the root causes of these disparities. Well, let me use an example. One policy that we might be all familiarized with is the war on drugs. This policy, as a result, has led to what we understand as mass incarceration. And when we think about mass incarceration, to put it in perspective, in the United States, we are 5% of the world's population, but yet 25% of the prison population. And the majority of people who are incarcerated disproportionately are people of color. And so this in itself cannot be ignored in the work that we do with problem gambling. We must think about it and say, how are these policies and the impact of these policies impacting the dynamics at the community level? We can do the same thing in healthcare, right? We can look at disparities in the healthcare and see that African Americans and Latinos have leading at the top of various health-related issues. We can look at education and see the same issues. We know that Hispanic people, for example, in the United States, live in poverty, a rate 6 times higher than the national average. Now, you might be asking me the question, Victor, why are we looking at this? Why are we not focusing on just raising awareness about problem gambling? Well, I'm gonna get to that in a second. I want you to hold on to this for a second as I continue here. So I'm gonna get to it. So the question becomes, how do we address these disparities? How do we address it? Again, in order for us to navigating the road to recovery, we have to understand these critical issues. One, as I mentioned earlier, we must take a public health approach. And taking a public health approach and the science of public health is about protecting and improving the health of families and communities. And it's the overall is concerned with protecting the health of an entire population and not just specific segments. Now, specific to this, to public health, a critical fabric of public health is what we call the social determinants of health. The social determinants of health, by definition, in its most simple terms, is the conditions in which people are born, where they grow, where they live, and where they work and age. These social determinants of health are broken down into various segments. And if we take a closer look at the social determinants of health based on its segments, we see various points under those segments. For example, in economic stability, we see poverty, employment, food security, housing stability. Now, let me pause here for 30 seconds. If we were to do a cross-reference of problem gambling and these social determinants, you will see a significant intersectionality of these issues and problem gambling. These social determinants of health, I believe, are the most critical elements to health. Now, that's just not my personal belief. That's actually in the data. And so I am sharing this today because our road to recovery must be about strategies that only improves recovery, but the wellness for all. And we must think about these social determinants. Now, you might ask yourself the question, Victor, why? How come? Why is it that we have to focus on these social determinants? What's your proof, Victor? Well, here's the proof. We understand by the literature, by evidence, not my opinion, that what makes us healthy, that 95% of health outcomes are rooted in the social determinants of health. People don't experience problem gambling because they don't have any knowledge of the odds of a slot machine, or they don't know how to set a budget. That is not the root causes of problem gambling. That's not the root causes of substance addictions because people don't know or unaware that drugs is bad. The root causes of these issues are rooted in the social determinants of health. So if we know this, then we must push our field to move away these simplistic elements and move into the hard work of addressing those social determinants, the disparities that exist in those determinants, and the social injustice that exists in them. That's the hard work. But that's the work that needs to be done in our collective effort to mitigate harms associated with gambling. Now, when we think about disparities, health disparities, to get more into the specific of it, we understand that health disparities are these factors that influence the social economic position of individuals and groups within industrial societies, also influence their health. According to Healthy People 2020, health disparities should be understood as a particular type of health differences that is closely linked with social, economic, and environmental disadvantages. I want you to hold on to that for a second. Because if communities and groups are experiencing these profound and disadvantages, then I ask you the question, how can these current strategies that are in our field address those disadvantages? How can they? Well, I'm here to tell you the answer to that. They can't and they won't. And that's why the statement that I make, that we will not accomplish our collective goal of mitigating harms associated with gambling unless we center it on equity. Won't happen, can't happen. Now I'm open. Come talk back to me and let me know if there's strategies and prove me wrong. But I'm putting that challenge out to anyone who can show me a different road of accomplishing our goals without thinking critically about this particular factor. Now, educational attainment and income provides the psychosocial and material resource that protect against exposure to health risk in early and adult life. Persons with low levels of education and income generally experience increased rates of mortality, morbidity, and risk-taking behaviors. Let me pause here for another 30 seconds. This is how we make the link to problem gambling. I was once told by a researcher that the two major drivers, the major risk factors that are the two major drivers that drive people from recreational stages of gambling to problematic stages of gambling is low educational attainment and low economic status. Hold on here for a second. If we understand this, and this is rooted in our research, that what drives people from recreational stages of gambling to problem stages of gambling, the two major drivers are low educational attainment and low economic status. Well, guess what? Those are the same risk factors that are necessary to elevate them to protect against the exposure of a health risk. And are the same risk factors that are experienced and other related issues. Hence, it illuminates to us the time has come that we must move rapidly to a public health model and stop with these segregated approaches to problem gambling. People are out here in communities that are dying, that are experiencing significant disparities, that are suffering on multiple levels. And it is our responsibility to speak to these issues and to bring those voices to the table to begin for us to have a conversation about a public health approach. And this is no knock to my folks who do responsible gambling work. There's a space for that. But our concentration must move, and our bulk of our efforts must move to a public health model because the data is clear. Now, let me move to some other data points. When we look at what is known as the NESARC study, to compound this point here, we understand that there's a high correlation between alcohol and substance abuse, as well as mental health to problem gambling. Those numbers that you see on the slide are not no lightweight numbers here. These numbers are heavy duty. The correlation between mental health, substance abuse is extremely high. Hence, once again, why we need to move into an integrative model. Now, to prove or to sort of summarize this point before I move on to other points, I want to be able to do a community profile exercise in a community known as Springfield, Massachusetts, which is in the western part of the state of Massachusetts. And let me just say that this particular data set that I'm using is only to illustrate the points that I have already made within this presentation. These data points have been updated on multiple occasions, but I'm using this data point to be able to illuminate or really illustrate the points that I have made. So it's only for educational purposes only. So in Springfield, Massachusetts, it's a community that from 2000 to 2010 saw that the population of Springfield was predominantly about 38% Latino. Particularly, the majority of the Latino folks are people of Puerto Rican descent. And it's what you call a minority majority community or city. But from 2000 to 2010, you saw this phenomenon in Springfield where whites were moving out and Latinos were moving in. So an increase in the population by over 43%. Now, in Springfield, in regards to the labor force, keep in mind that those two major risk factors, right? Educational and income. I want you to hold on to those major risk factors because that's what we stated here, that the two major risk factors of the transition from recreational stages of gambling to problem stages of gambling are low educational attainment and low economic status. So hold on to that for a second. When we think about the labor force, we see here some really interesting data points. We see that for Latinos, the total workforce from age 16 to 64, which represent 55%, which is the second lowest among all population. And it represented 20%, which is the highest among all populations. And the rate of home ownership, which is a critical element of owning a home for establishing wealth or putting someone in a better position, was the lowest among all population. When we look at health, we see that Latinos rank within the highest in regards to obesity, asthma, diabetes, HIV, and cancer. Okay, I'm just giving you a community profile here, guys. When we look at education, we see that Latinos represent 58% of the school population. Yet in turn, when we look at other data points in regards to the educational experience of Latinos in Springfield, we see that 14% was an increase in the student population from 2001 to 2011. So you see this increase in student population over a 10-year period. Yet in turn, Latinos had the highest amount of absent days from school, second highest, and the bottom line had the lowest graduation rate. Now, why am I doing this, guys? Because I am challenging us. I'm challenging us to move to a public health approach. Because if these were the experiences, or are the experiences of Latinos in Springfield, and you can do this for Baltimore, you could do this for any city in America, then the question becomes to our field and those that labor in our field, what strategies are we utilizing to navigate that reality? Do we really believe that our RG strategies that we have in place is addressing that reality? When we understand that that reality is responsible, that reflects those social determinants of health, and do we really believe that we're meeting the moment? I am calling us to meet the moment. I'm asking us that if we want to navigate the road to recovery, we must meet the moment and do the hard work and begin to ask the core questions of why are people experiencing these significant outcomes. Now, let me move on. We know that when we look at health disparities and some key points, that there are millions of people in the United States that experience individualized and systemic discrimination based on a whole host of factors. And we must think about, now that we've addressed this, how do we build equity? Which is another major fabric of public health. How do we do this? Well, as I mentioned multiple times, we must move away from this narrow focus of just the individual gambler to a broader consideration of the social settings. And, when I talk about that historical disconnect to the community experience of gambling, because oftentimes when people are experiencing gambling, they're experiencing other things. It's just not just gambling. Underground gambling is real. And that element, that cultural dynamic within that is real. And so we can't use some of these strategies that we have come to like or enjoy them and think that they fit within the reality of the community experience of problem gambling and people of color. We must be open to changing this, or even sometimes letting them go and moving on. We must be able to meet the moment and be able to shift our thinking. So now let me move on to this illustration really quickly. Because when I talk about building equity, a lot of my folks who I work with or who I have great relationship throughout the country use this illustration as a way to illustrate the difference between equality and equity. And for the sake of time, I'm not going to put us through this exercise that I typically do here, but I just want to point this out as a way of helping us to shift our mindset. Oftentimes, when we talk about equity, people think at the core of equity is the distribution of resources. And that is a piece of it. And so you see, when it comes to equality, equity, or the reality, you see the boxes, and the boxes represent that distribution of resources. And people think that if we redistribute the resources to communities that are experiencing significant disadvantages, that is at the center of building equity. It's a part of it, but it's deeper than that. Now, what people don't point out often is that oftentimes when there is the practice of distribution of resources, communities of color and communities that experience great significant distress are often looked upon as having some needing to be rescued, needing to be helped, as if we come to, or we show up with levels of not understanding or things that, or some kind of deficit. And let me say that type of approach is not recommended. Communities that experience great disadvantages have great strengths, have significant cultural intelligence, have significant intelligence that we need to listen and learn in our work to develop partnerships and collaboration. In this illustration, I don't focus a lot on the boxes. What I focus is on the fence, because the fence represents the systemic racism that exists in our society. And our goal is not just about distributing the boxes. That's part of it. But it's also breaking down that fence, which represents systemic racism that continues to marginalize and oppress communities. So if our focus is say, look, if we take a closer look at different communities in Maryland and ask yourself the question, why does the health outcomes look the way that they do? Oftentimes people would think, oh, they didn't have a resource, or, oh, by the way, there's a deficit, a lack of whatever. When in reality is that the conditions at the community level, which represent the social determinants of health, is where we see the greatest levels of inequities. And so our work is not about the boxes. Our work is about tearing down the fence so that people can be able to be on a road to recovery and maximize their potential of health and wellness. So health equity, in the most simplest term, is really about the commitment to reduce and ultimately eliminate disparities in health. I believe we have a moral and ethical obligation of eradicating disparities in health. Building health equity is not about providing every individual with the same type of service or simply treating individuals or entire communities as the same, as I mentioned earlier. Instead, building health equity requires that policymakers and responsible gambling program developers, along with problem gambling treatment providers and healthcare systems, strives to understand the specific and the collective needs of individuals and entire communities. Again, communities come with great strength. They come with great intelligence. Let me give you an FYI, we don't need to be rescued. To address racial and ethnic health disparities and build health equity, it is important that we understand the role of culture, cultural humility, and developing cultural intelligence. Let me explain this for a couple of seconds. When we think about cultural humility, is that it's important to understand that we're on a journey of lifelong learners. And so that's why I'm not a fan of the term culturally competent, because because we can never arrive to a point of being competent on culture, because by the definition of culture, we know that's ever evolving and ever growing. So hence we can never be culturally competent. But cultural humility means that we take a look inward. We look in the mirror and we think about our own biases, our own thinking, that how we have been influenced around specific issues, and go on a journey of trying to address that. As well as cultural intelligence really illustrates that communities have significant strengths. But oftentimes we come with our agenda. We believe that we have expertise, something that I've been seeing, noting all over the country in different of these conferences, especially in our field, where people say, oh, I'm an expert on problem gambling. You're not an expert. We need to stop. When we use that term in describing ourselves, we negate the potential and the opportunity of listening and practicing humility and cultural intelligence. And then we ask ourselves the question why we're not connecting with communities. Well, we need to start with yourself. So now let me move on to some other points here. When we look at the health impact pyramid, this is the pyramid that demonstrates where's the greatest impact for health. And we know that traditional disorder gambling program efforts are based on counseling, education, individual interventions, which again, these are needed and necessary. And I applaud the many folks who are in the audience who do individual therapy, who work in systems of health, and that should be applauded and supported. And as a practitioner myself, and as a social worker, I applaud you and the work that you do. But for us to move into impact and to impact health and health outcomes, we must move to address those social economic factors where we see the greatest levels of inequities in order for us to be able to have the greatest impact on health. So now how do we think about promoting equity and social justice? And I'm keeping track of time, so I'm coming to the tail end. And I'm so grateful and thank you for hanging in with me for these 45 minutes or so, but we're now coming towards the end. And then we'll take questions in about 15 minutes. So if you have questions, please either write them down or you can put them in the chat, and I'll definitely be around for 15 minutes or so to answer questions, but we're now coming towards the end. So how do we promote equity and social justice? You know, Brian Stevenson stated that there are 4 keys to increase justice. Get proximate to communities in need. We got to step out of our bubbles, out of our comfort zone, connect with communities, listen, learn, and participate. Tell the truth to change the narrative. As I stated when I first started this presentation, I gave you the disclaimer that there might be some things I'll say to make some of us uncomfortable. But we have to tell the truth to change the narrative. We must be hopeful. We're in the hope business. We must be able to be hopeful that in our collective work, we can work together to mitigate harms associated with gambling. And lastly, do the uncomfortable and the inconvenient things. And this is why I say to people, oftentimes when I speak to people, they say to me, oh, Victor, that stuff that you talk about, that's so hard. Yeah, but that's the work, man. That's what we got to do. That's what we got to do. Let's do the uncomfortable and the inconvenience things in order to change these health outcomes. Now, let me speak a couple of minutes about community engagement. Public health requires that the public participates to plan, develop, and implement strategies. My first questions to folks in our field, I ask them all the time when they come and say, oh, I got this new innovative thought and these new strategies. And I say to them, can you explain to me your community engagement strategy? Well, we didn't have no, we just thought, so-and-so has expertise and they thought that this was best. Really? That's the way it works? No, man. If we are working in communities, it is imperative that we bring people to the table, that we engage people, we listen and we learn, and that in a partnership, work together to develop strategies, right? And this is about creating a path to empowerment. Hence why I say, I'm no expert. I'm just Victor Ortiz. I'm just privileged to serve in this space and lend a voice, but I'm no expert. And oftentimes, too many of my colleagues, I don't know if it's in the water, but are going around lately and saying, oh, I'm an expert, I'm an expert, I'm an expert. Really? Where's the humility? That sounds like arrogance to me. We have an obligation to, if our goal is to mitigate harm, specifically those that have been disproportionately impacted, then we must have an extra dose of humility to learn, to listen, and to find a path for empowerment. Now, as I'm going to begin to wrap it up, let me just say that we cannot create healthier communities and healthier society if we're not brave enough to get uncomfortable. We need good people to position themselves in difficult places. This was a statement by Brian Stevenson, and as I close out a little earlier than I was scheduled for, which gives us, I see a lot of hands that have been raised and I see a lot in the chat. I just want to say that we're at the crossroads. We are at the time in our field that we must begin to pivot. The landscape of problem gambling is changing. It is incredible to see that changing landscape. And I am concerned that as the landscape continues to change and evolve, that disconnection of the community experience of gambling and people of color becomes not better, but it's becoming worse. And I want to state that I respect the work of individuals in the responsible gambling space. It's a necessary strategy, but it should not be the core of our work. It should not be at the center of our work. And if you so believe that it is and should be, then I'm here to tell you that you will not and we will not accomplish our goal of mitigating harms associated with gambling. The evidence is clear. To wrap this up, the social determinants of health are the drivers of health outcomes. The conditions where people are born, where they grow, where they live are responsible for 95% of health outcomes. We understand today, as is rooted in the evidence in gambling, the educational attainment, low economic status are the drivers, the two major risk factors from recreational stages of gambling to problem stages of gambling. And yet we think and believe that our current RG strategies is helping that. Again, I came here to hopefully create a space for us to think. I hope that I was able to deliver that today. And so as I close out, I'll be remiss if I didn't take a minute to thank not only the folks that I thanked at the beginning, but I want to thank Dr. Deborah Haskins, who's a treasurer in our field, who for multiple years, my wonderful sister has been leading this charge of echoing these perspective. And Baltimore and Maryland have been benefited from Dr. Haskins' work. And thank you, Debbie, for all that you have done and continue to do, and created a space for me to share my truth and my perspective. So with that, I close. I thank you once again. Thank you, Marilyn, so much for the warm invitation. It's always fantastic to be in Maryland, although virtually. I would have loved to have been there in person, enjoying some crab cakes and maybe catching the Orioles game because they're doing a little bit better. But that's not the reality. But thank you, Mary, to Mary Drexler for the invitation, and thank you for the phenomenal work that's being done at the Center of Excellence. So keep up the great work. So with that, thank you so much.
Thank you, Victor. I have put up my video, but it's not coming through once again.
We see you,
Oh,
Mary.
you can see me. Thank you.
Yes.
There were a few questions that were in the, here we go. There were a few questions that were in the question and answer, and I think some people got confused. There was no access to chat, but you could put questions in the Q&A section. But here's a couple of them. Why do you think responsible gambling hasn't taken a public health approach? Because so many other addictive behaviors are recognized in the field, but it seems like gambling isn't. Is it because it's been a personal or looked at as a personal problem for so long?
So thank you for the question. I think that, we must give space to acknowledge that responsible gambling is really, and its approaches and even its establishment as the Reno model is still very young. And just like anything that's new or young, there's going to be moments of turbulence and moments of, trying something, changing it, things of that nature. So I think that there's a lot of that associated with it, but it's also part of it is because we as public policy folks must step up to the plate to create space for other conversations like a public health approach to problem gambling. And, at the same time, we can't negate that this relationship with the industry is also part of that as well, right? And so I think that there are hard conversations to be had. And again, I want to stress this. I'm not saying for us to move away from it, but what I am seeing, Mary, and the person who asked the question, it has become the center of all of our strategies all over the country. And that to me is concerning.
Yeah, that question was from Blair Innes, and she had one other question. Have people
Sure.
of color been targeted by the gambling industry the way they have in other areas like tobacco?
I always don't like to speculate on those things about
Okay.
targeting, because I don't think that's fair.
Yeah.
I think that what I like to say is that we must understand, as I showed in the illustration, that communities of color, and it's a fact, experience systemic racism. And so that in itself, and the cause of racism, which is a public health issue, That in itself has a lot that we need to continue to work through. And I think that that in itself is where the bigger work has to happen. I get questions all the time about whether communities of color are targeted by the lottery or the casinos. And I don't like to get into speculations because I think that opens up another can of worms. But I do think that the bigger question or the bigger issue is about systemic racism and the what communities of colors experience. And then how does that then tie into problem gambling or gambling as an escape from the, from the stress of the experiences that people experience. And so I think that's, to me, where I like to focus my energy on.
Okay. Next question from Mr. Gomez is, it's kind of a long question.
Yeah, sure, go for it.
You said that a protective factor for the change from recreational gambling to problem gambling is higher education attainment and higher socioeconomic status. However, you also said knowing gambling odds of a slot machine doesn't make you not play the slots, and knowing drugs are bad for you doesn't make people stop doing drugs. Can you elaborate? Because I'm a bit confused.
Okay. So thank you for the question, Mr. Gomez. I really appreciate that. So let me just stay here that when we look at the data, public health data, there is evidence in the substance abuse space, for example, that just simple awareness doesn't change behavior, right? Simply making somebody aware that drugs is bad or whatever, or gambling is harmful, doesn't change behaviors. That's in the data, right? So public awareness campaigns are important, but we must tie public awareness campaigns with other programmatic efforts. In other words, they need to be comprehensive. Now, the other thing to that side of the thing is, why don't they work? Why doesn't these sort of just education elements work? Well, because we understand that what drives people to gamble, as well as what drives people to use drugs, is not rooted in the lack of knowledge of information. It's rooted in other experiences that are more rooted to the social determinants of health. And so that's why the data shows that the two leading risk factors that drives people from recreational stages of gambling to problem stages of gambling is low education attainment and low economic status. The number one risk factor in our society of negative health outcomes, including problem gambling, including substance abuse and many other, is poverty. Is poverty. So this tells us and sets us up in a way to say, look, yes, we should create public awareness campaigns. Yes, we should provide education. But at the same time, we cannot put a blind eye to the experiences that people experiences that drive them to take on risky behaviors, including problem gambling. And those behaviors, those issues are not lack of information. And so people think, and oftentimes I get told, or people share with me and say to me, oh, Victor, if we teach people about financial literacy, that's a new one now. I speak on that. They won't gamble as bad. I laugh. I said, do you know that financial literacy overall is important to everybody? I encourage that. But when people are living in poverty or people go gamble, there are folks that gamble not for entertainment purposes, but because they want to escape poverty. So again, I think it's important for us to take a closer look at these messagings that we put together and understand that the drivers of why people use drugs, gamble excessively, are not rooted in the lack of awareness.
Thanks, Victor. A kind of a broad question by Ms. Bozen was, what would a successful intervention look like specifically?
Ooh, that's a great question. I don't know if I have the magic bullet for that one, but let me share this. I believe that there's no single intervention that will be the intervention to be to rise to the occasion of mitigating harm. I believe that whatever we do, whatever said, needs to be comprehensive. Hence, the data in prevention tells us about multiple strategies across multiple domains. And I think that today's people's experiences in health and the intersectionality of problem gambling with other related issues require us to have comprehensive approaches, in regards to our effort. And so when I think about the University of Maryland, some of the work that you're leading, Mary, I look at, there's a broad element of different activities that are happening. And I think that that comprehensive approach is what will get us closer to being successful, not just one thing. Because gambling is too complicated, and there's too many moving parts in regards to problem gambling to think that just one single strategy is what's going to be the magic of all things to get us over the hurdle. It needs to be comprehensive. So when I mentioned earlier, I said we need to think about when we do public awareness campaigns, that's important. So I want to keep pushing for that. But I also want to say that as part of that effort, we need to have programs at the community level. We need to have access to treatment. We need to have helplines. We need to have various different strategies that are available for folks at the community level. So I believe that we need a comprehensive approach in order to mitigate harm.
Okay, another question from Ms. Heath, which is, are there specific agencies, positions, or things that we can do, people or agencies to contact to participate in helping make this change?
That's a phenomenal question. I thank you so much for that great question. You know, I think one of the key elements that has to be done is that we have to work, and I know this, what I'm about to say sounds very cookie cutter and very simplistic, but I mean this, is that we have to work in partnerships. We have to be deliberate about, if we're working in the city of Baltimore, for example, we need to identify who are the bridges to the community, where are the specific resources that people sort of connect to, whether they're faith-based institutions or organizations, community-based organizations. And we must be able to work in a collaborative way, in a way to lift up those community voices and put strategies in place to address these issues. And in Maryland, there are multiple opportunities for people to work together. But unfortunately, what happens is things get in the way, right? People's agendas get on the way, other things get in the way, and then the hard work breaks down. But in order to do that hard work, there has to be a focus. There has to be a focus of what we're trying to accomplish here, you know? And it requires that in that partnership, that there needs to be some hard conversations to be had. Because I'll tell you, when I look at the data in Maryland, there are significant disparities that are experiencing right now in the city of Baltimore. And so as gambling continues to increase in the city of Maryland, in the state of Maryland, I'm asking the questions, how are we addressing the disparities of health that are happening in Baltimore and other cities in the state of Maryland? And if we're not having that conversation, if we're not talking that way deliberately, then we're missing the mark. And so again, getting to the question, we have to work in partnership and really partner up, because there's a lot of great people in the state of Maryland doing fantastic work in this space. And we should connect with them and work with them to do that work.
Another question is, do you have or know of like one or two impactful policies or recommendations that could be used with our regulators to enact things through regulation or legislation that will help with this process?
I think that, thank you, whoever asked that question is a great question. I would tell you that I was asked recently by some folks in a different state about the similar question. And I gave them a response that I don't think people were expecting. And that is typically what happens is that in legislative processes, people really advocate for a lot of, again, going back to these responsible gambling elements. And some of that stuff is important to have, right? I get that. And there are many folks who believe that just by establishing that, you've done your due diligence, you check it off the box and you move on. I'm here to tell you that I think that, you know, part of the work that needs to happen is we need to expand the conversation to talk about how are these developments that are happening in the expansion of gambling, what are the economic benefits and what are the economic processes for specific communities, right? How are we looking at that? You know, what are the benefits to, or what are the opportunities to lift up educational, and when I say education, I'm not talking about awareness, I'm talking about systems of education. How are we improving those realities for different communities? See, those are the conversations we should be having. Because if we know that the two major risk factors related to the transition people from recreational stages of gambling to stages of distress related to gambling are low education attainment and low economic status, then I would say that in itself is where we need to build off, period. Not saying that, negate some of the RG stuff that we are advocating for. That's all fine and well. But again, if we don't speak to that issue, then how are we changing the realities of communities that are disproportionately impacted by gambling?
Next question from someone you know, Ms. Rugel. How can we
Hey,
address-
Lori.
How can we address the income that states receive from gambling as a regressive tax that has a disproportionate impact on lower income communities?
Oh, Lori had to ask me the toughest question. I think that was her gift to me since I'm back in Maryland. Lori, that's a phenomenal question. It's a question, that we kick around often. And I think that, again, this is why I say we have to talk truth to power. This is why it's important for us to work together to begin to create platforms on a national level about what we want to see moving forward. And I think that we are doing a better job at that, but we can improve in those areas to speak to these issues. And I'm hopeful, I am very hopeful that we can continue that journey to really speak up. Look, Lori knows well that, over the last 10 years, this is, the work that I have lifted up here in this space and my contribution in this space is really speaking to these topics. And this is my contribution in this space, but it's not my sole responsibility. And so what I have continued to do is to lift up these topics in the hope that there is collaboration and partnership so that we can ultimately speak to these issues and then hopefully create pathways for wellness for all, not just for some.
Okay, next question. We have time for a couple of more. Any that we don't get to, we will get them sent to us and we can forward them to Victor or we can try and respond to them. But let's see. And let me go back up a minute. I don't want to miss a question from Heather. If your program has limited funding, do you suggest the best way to go is community grants to organizations serving minority populations?
Yes, let me go a little deeper there. I know funding is an issue, right? It's a major issue. There is still a lot of good work that can happen. When I started this work in problem gambling, this was pre the expansion of gambling in Massachusetts, where there was then an influx of resources. And the first thing I did when I started this journey is I partnered with communities by simply providing education in their settings and things of that nature. So partnerships and collaborations are important. And then being able, if there are resources that you do have that you could share through grants or whatever to help support communities, I highly would encourage that. But it also, just grants alone is not the fulfillment of community engagement. But I do think it's an important part if you are able to facilitate that.
Okay. And next, can you give, from Mr. Block, Stephen Block, can you give an example of a strategy to mitigate harm?
Hi, Stephen, how you doing? Well, the strategies to mitigate harm, as I think I mentioned throughout this lecture or throughout this presentation, has to be comprehensive, right? And so whether we're conducting a whole host of strategies, whether it's providing access to helplines, whether we're developing access to public awareness, whether we're providing access to treatment, those are all formidable strategies. And so let me state here that, my father taught me as a little boy that we don't need to reinvent the wheel. We have to just give it a front wheel alignment sometimes, right? And so there is a lot of good work that's happening in our field. And so what we need to think about in that work, how is equity being promoted? How are we thinking about that historical disconnect to the community experience of gambling and people of color? How are we creating an influx of innovation in the responsible gambling work? So Steve, to your question, I don't think we need, there's always room for new strategies, but I think that we don't need to throw the baby out with the bathwater. I think that there are things that are happening in our field that we can do better, right? And that we can do it in a way that promotes equity. And my concern is that as I see that work, I often ask myself the question, how do people like me show up in that work?
Yeah.
And so that's what we need to think about critically. So thank you, Steve, for the question.
Yeah, we could probably do one more question. Interesting one, because I happened to see the press this morning when I was watching very early morning news. But there is some pressure politically from the top here in the state of Maryland that our gaming commission expand the online betting to mobile capability quicker than they seem to be rolling it out. And everyone they interviewed, and I saw this news story, said they would gamble more if they didn't have to drive to it. But there was not any kind of messaging related to the opposite of that, that this is just going to make it so much more attainable and could get more people finding themselves in trouble. And what I had seen, and I'm sure this individual, Miss Holland, saw, was they were really moving on the, look, you can do it from your living room couch. This is great.
Yeah, that is a topic that is being is being discussed in multiple states right now all over the country. Look, we understand that, as the title of this conference states, there's a changing landscape.
Mhm.
And boy, that technology, Mary, and to everyone in the audience, is changing in a way that's incredible. It is actually, all of the technology. And so I think that the obligation in our field is that we, and I know that I sound, and I'm stating this in a very simplistic way, and I don't mean it that way, but we really need to think about a platform that allows us to really work in a collaborative way to meet the moment. And I don't think that we have that. I think that right now it's too fragmented, it's too isolated. There are too many moving parts, and some of the moving parts are just antiquated or maybe disconnected. And I think that until we don't come together in a way that identifies clear principles and clear vision to help, really speak to these topics and concerns with these values that I illustrated in this lecture, then we're going to be at a significant disadvantage. And so that is the reality that we're confronting. And that's just not only us here, not only in the state of Maryland, but that's everywhere where people are popping up these opportunities that we know will increase greater exposure and access to gambling, which again will create an opportunity for increase in risk.
Well, I